So now let's talk about the different terms used to describe joint movements. So the first one is flexion. So to understand this, we have to see this diagram. So here you can see this is our arm, and this side is the flexor side and this side is the extensor side. So during the flexion, flexor surface approximate. So this surface, it is coming close to each other when we are bending our arm, and this is the joint angle. So you can see joint angle decreases. So in flexion, these two surfaces are coming with the approximating each other, and the joint angle is decreasing. So this is called flexion. And when we straighten our arms, then joint angle increases, and the extensor surface, which is this, it is approximating. So this was the example at the elbow level. Now let's talk about flexion and extension at the shoulder level. So this is our shoulder joint and it is at rest, and when we move the arm forward, this is called flexion, and when we move the arm backward, this is called extension, as it is approximating the extension surface, and in this case it is approximating the flexion surface. Also in the wrist joint, as you can see in the wrist joint, when we straighten our hand or palm, then it is called extension, and when we make a fist, then it is called flexion. Now let's see extension and flexion at the level of hip joint. So this is our hip joint, and when we move our leg forward, then it is called flexion, and when we move our leg backward, then it is called extension. So this is flexion and this is extension. Also in the ankle joint, when it moves upward and downward, so when we move upward, then it is called dorsiflexion instead of flexion, and it is here you can see it is neutral, and when we move downward, then it is called plantar flexion. So it is nothing but given on the surfaces, that this surface is dorsum and this surface is plantar surface. Now let's talk about abduction. So abduction is movement away from the midline of the body. So let's see in this diagram, this is the abduction. So this is the midline, and when we are moving away from the midline, that this arm is moving away from the midline there, then this is called abduction, and when we are moving it towards the midline, it is called adduction. So this is the abduction and adduction, and you can also remember it by AD means add, then means we are adding. So this is a simple mnemonic. Then rotation, it is movement around a long axis. So when we moving our hand, then our then it is called rotation. And circumduction, it is a combination of flexion, extension, abduction and adduction. So when we moving in a circular manner, we are moving up in abduction, adduction, and then using both the extension and flexion. So this is a diagram of the circumduction. Now let's talk about supination. So supination, it is mostly found in palms. So when the palms are facing upward, as you can see, the palms are turning upward or facing upward, then this is called supination. And when the palms are facing downward or turning downward, then it is called pronation. And simply the inversion and eversion, they are related to the feet, in which inversion is medial rotation of the foot. So when we are rotating in the medial direction, that is it, the midline is here and it is rotating in a medial rotation, then it is called inversion. And when it is rotating in a lateral rotation, as you can see, this is the lateral surface of foot and it is moving in the lateral rotation, then it is called eversion. So this is the medial rotation, medial, and this is the lateral. The last one is protraction and retraction. Protraction simply means when the jaw is moving forward or sliding forward, and retraction is simply opposite, that is the lower jaw is sliding backwards.